And Lori, I think, would it be too early to say, you know, I think if people do want to turn on their cameras, it's always helpful in conversation, because we will open up on several occasions throughout the hour today, the time for folks to share out and to dialogue with one another. So it's always best when we see folks on camera, and certainly actively using the chat box as well is always helpful.
Hi, Amber.
Hi, Amber.
Hello again.
Okay, and we're going live. Chidi, I may make you the host just because I'm having to manually admit everyone. And I don't know if I'm gonna for sure be able to see my screen. Is that okay?
Absolutely.
Okay. So I can do this. If not, we'll just keep going. Okay, it looks like I can't because I'm live streaming. So we'll just keep going. I'm gonna go ahead and share my screen so that you all can see your presentation, and then we can get started.
Great.
Right, and we're good to go. So I have the pleasure of introducing Lori and Chidi, who will give you more background on what they do. Thanks everyone for joining.
Great. Thank you so much, everyone, for being here today. There are, and can you hear me okay? Okay, great. There are even more people than we had originally seen as registered, and so we are just so glad that you all could not only participate in the first ever, but the first day of the first ever in this community chat of the Racial Truth and Reconciliation Week. My colleague Lori Crawford and also Martin Parker is on this call. We will introduce ourselves, but we're just so glad that you all are here today with us. Whoa, someone's doing art on our presentation here. Am I crazy?
Is that really happening? Oh my gosh, I don't know how that happened. I have no idea where that is.
No, it's quite all right.
Let me just, wow. Okay. Just keep going. We'll just play it off.
Quite all right. So glad that everyone could be here. So I'm seeing that we have several more participants than we had originally anticipated, but Lori and I did want to give some space and time, since this is a community chat. Oh, we have a friend who is, we would love to hear just who's on the call and where you are joining us from. So with that, I would like to go ahead and present myself. I'm Chidi Uche, project specialist on the Virginia Heals, on the Virginia Heals project. And I also serve as Governor Northam's advisor on childhood trauma and resiliency. We were going to do a quick little open up, but I think because of time and how many folks are joined with us, I'll just pass it to Lori.
Good afternoon, everybody. I'm Lori Crawford, and I am the project manager for Virginia Heals, which is, I work for DSS. And we'll obviously tell you more about the project, but some of you may have heard it referred to as Linking Systems of Care. We just rebranded, so hopefully at least a few of you have, but we will talk more to you about that shortly. And Martin is a new member of our team. He won't be presenting today, but I would like him to introduce himself to our partners.
Hello everyone, my name is Martin Parker. I'm a project specialist with Virginia Heals. Just want to thank you all for participating. Like Lori said, I may not be speaking much today because I've just joined the team this past week, but I'm looking forward to the presentation.
Awesome. All right, and do you see your screen up for the presentation? You're on mute.
Let me see.
I do see the first, yep. There you go.
Awesome.
Does Carol Olson, do you want to introduce yourself and let us know where you're coming from today? Oh, looks like she's talking to someone else. Rachel Reynolds.
Okay, I'm Rachel Reynolds. I work for the Virginia Mental Health Access Program, and I'm also part of the Cameron K. Gallagher Mental Health Resource Center at VTCC.
Great. Thank you for joining us. Amber Colby.
Sure. So I'm coming from the Office of Family Violence. I'm a contractor there working on the Promising Practices Guide, specifically on survivor voice in that.
Great, thank you. How about Sarah Herrig, a familiar name, I think.
Yes, hello. I didn't know you were presenting. I'm Sarah Herrick. I'm the clinical program manager for mental health services at Family Service of Burnett Valley, and I'm a licensed professional counselor and registered play therapist.
Wonderful, thank you for joining us today. How about Rodney Colbreth? Oh, I think you're on mute.
Hi, Rodney Colbreth, co-founder of I'm Just Me Movement.
And the Winchester Area Trauma Informed Community Network.
Area Trauma Picking.
Great, thank you so much for joining us. I see some, Carol Olson.
Oh, hey, I'm Carol Olson. I'm been around for a while, but now I'm at VCU, Project Empower. So I'm the coordinator here, and we're a hospital-based program for
Wonderful,
sexual
thank you.
domestic violence.
Perfect. Thank you for joining us. And then to the people who I don't see on camera but are in the participants list, Amanda Ferris.
Hi there, I'm calling in from Healthy Families at Humankind.
Thank you for joining us. Amy Garman.
Hey, how are you? I am Amy Garman with Child Savers.
Oh, wonderful. Thank you for joining us today. How about Bridget Mahoney? Okay, how about Chelsea Moore?
Hi everybody, I'm Chelsea Moore. I'm with the Rappahannock Rapidan Community Services Board, and I serve as the Community Opioid Response Director.
Fantastic. Thank you so much for joining us.
Absolutely.
Kelly Brown. Kelly, I think you're unmuted. Are you talking? All right, we'll move on to Kira or Kyra Parker.
Hi, yes, I'm Kyra Parker. Can you hear me?
Yes.
Hi, yes, I'm Kyra Parker. I am a recent graduate of Virginia Tech. I'm currently affiliated with the Concerned Citizens Network of Alexandria, but I'm looking to get involved with trauma and mental health in that field. So I'm looking forward to the presentation today.
Great, thank you. Linda Sharp Anderson. How about Rachel Reynolds? Did we already got you? Just kidding. Rashida Farid or Farid?
Rashida Farid, Petersburg Department of
Hello?
I hear her. Oh, she just dropped out. Oh no, there she is.
Out.
Petersburg Health Department, I think.
Social Services.
Social Services, okay. What about Suze Bono or Bono?
Hi, yeah, I'm Suze Bono, and I'm a bilingual parent educator with Family Lifeline.
Welcome.
Great, thank you for joining us today. Is there anyone else that I missed or who didn't get to introduce their name and where they're joining us from? Okay, so I am going to go ahead. Oh, Kelly Brown says she's with Richmond DSS. Great, thank you so much. Well, we did want to open the space when we thought we would have a smaller group, and we are glad that we have almost 20 people here on the call with us today. A question we were going to ask, not only of where you, what your role is and where you're located, but also why you are joining this community chat today, and more broadly, participating in Racial Truth and Reconciliation Week. And so as we are going through the course of this conversation today, despite not being able to share with one another, consider just but to the collective work that we have to do when it comes to racial truth and reconciliation. I will say for myself, the reason I am participating this week is not only for myself as a Black woman, but also for my community. Participation in anything that can help the cause and incite conversation is important to me. And so I'm so glad that there are so many of you. So as we move forward, and you can move forward, Chloe, if you'd like, we want to give you some information on the Virginia Heals Project, and just give you some background on what that is. We were formerly known as the Linking Systems of Care Project, which is still, and until March of 2021, a demonstration project which has been funded by the Office of Victims of Crime at the Department of Justice. And so we are one of 4 states who are participating in this demonstration project. Ohio, ourselves, Virginia, Montana, and Illinois are the 4 states who are participating in the project. And ourselves in Montana were the first 2 states to join the project, and the other 2 states joined a couple years later. So we had a little bit of a head start, and we will end a little bit earlier than they will. But the goals of the project, of course, were to identify and screen for trauma and victimization. Once that has been identified in an individual, particularly a child or a youth, the goal is to then connect them to services that are appropriate and needed for them based on the experiences that they've had. And then the third goal from the feds was to develop policy around supporting and sustaining efforts such as the ones that we created, more long-term. And so planning began. Say it again.
Nothing, go ahead.
Sorry. So planning for this project began in 2015, so we're about 5 years in, and we are now in statewide rollout. And so we're going to share a little bit about what that means, and more importantly, how that relates to the broader topic of family voice and choice, especially when we're talking about trauma-informed care and trauma-informed service delivery. But also when it comes to the impact on the experiences of people of diverse races in our communities and here in Virginia generally. So there has been a lot of work that has gone into this project, and we just wanted to share a little bit about the background. So we do have a national steering committee who provides us with technical assistance. NCJS are the National Court family judges, and they have been amazing throughout this project and provide a lot of help to us as we continue to and have been building resources that are accessible for folks in community, particularly service providers, as they provide appropriate services for children, youth, and families. Before we got our work started, we did do many activities and surveys and events to be able to ensure that Virginia was on the right trajectory in order to, at the end of our project, be able to look back and say, we created or developed or did work that was meaningful and important to the needs of the state. And so that started with a stakeholder survey, which surveyed over 1,300 individuals about what really was needed in community the most. We did organizational assessment surveys as well, cross-system mapping events, which were really amazing to be able to identify where resources were at the time, what was missing, and how the resources that already existed could be better and more effectively used to connect individuals, particularly those who had experienced victimization or trauma, young people in particular, to the services that they really needed, especially based on their identities, the cultures, their experiences, so that they would get their needs met. And so a statewide listening tour also was a part of that. And so I was not on the team at the time, but the tour was to all the corners of the state and really engaged individuals in what their personal experiences were, and when it came to their experiences, whether they were adults discussing their personal experiences or those of their children, or as children and youth, what their experiences in being involved in the system were. And all of this collectively impacted the direction that our project went in. So I will pass it to Lori.
So thanks, Judy. So just to kind of talk to you a little more about the listening tour, because this is actually, out of all of the kind of data collection talking that we did via surveys and mapping events, we really were struggling, like figuring out the best way to actually get the voices of those who had experienced systems. So youth with, or folks who had been youth with lived experience, their family members and caregivers, you know, what was it like for them? Because it was valuable and we wanted to hear from service providers, but also that doesn't necessarily, it doesn't at all replace the voices of the folks who experienced it. And so it's kind of one of our lessons learned that as a demonstration project, Virginia, Montana were the first two states that did this work, and Ohio and Illinois got to learn from our lessons learned. We wish that we had done it a little earlier, but needless to say, in about 2017, a couple years into the project, we started planning this listening tour, and you know, had to go through all of the institutional review board approval and trying to get, you know, where we could offer gift card incentives for participation. You know, it's a long process to set this up, but essentially we went, as Chidi said, to kind of the corners of the state, 5 different regions, and wanted to get input where we had basically focus group conversations about folks' experiences, and the kind of target population on the family and youth, those with lived experience side of it, groups, was focused on youth who had been involved in more than one system, because as you know, the name was Linking Systems of Care. This project is really all about cross systems. It's not everything that we make and the resources Chidi will share shortly. Everything is about, you know, being able to be used, whether you're in child welfare or you're in juvenile justice or you're in behavioral health, you know, all the different systems. And so we wanted to talk to those who'd experienced, you know, being in this system and sent to this system, and where there were gaps and what we could be doing better, and also what, you know, kind of things were good experiences too that we could build upon. So there were sessions held in 5 localities. Again, we had youth, parents or guardians of youth, and direct service providers, and then experience in all of these different systems. So when we look back, these were families who had been involved in a lot of different systems. This went on for much longer than we had anticipated. The initial plan was that we would reach out to families via the system. So we reached out to DSS and to these other, you know, CSBs, community services boards, and we would say, hey, can you put these flyers out and see if you can have people who are involved in your system talk to us about it. And what we found out was that, you know, if they're having a bad experience with systems, they're probably not going to tell the people who are in those systems that they're having a bad experience. So we readjusted, and what we did was started going through existing youth peer support groups and other places where families and youth were already going that were kind of outside of those systems for services and support. And then we really had we're really successful in getting the voices of those folks. So if you want to move on to the next slide. So there were a number of kind of themes that came up. And just to let you know, there is all of these reports or data collection things that we've been talking about. The full reports are on our website, which will be on this slide, but it's virginiahealsspelledout.com. But these go into more detail, but essentially the key findings are probably not going to be surprising to you, but they said that there were challenges navigating systems, that essentially they would go from one system to another, kind of popcorned around and bounced around, that everybody would say, okay, go through these things, and then they'd send them to another system and they'd go through their services, and essentially they weren't coordinating well. Service quality, meaning that there was real inequity in terms of the services that were available to different folks. So depending on, definitely how much money you had, what kind of insurance you had, even what time, you were able to access services, and then inequitable restrictive service access. So this, is kind of where we're really gonna tie in on these last two bullets, focus in on this presentation. But, that they felt that they were not, there was not, the same services were not available across the board to the same populations of folks. In addition, they weren't geographically, they just weren't equitable. So even if you think of what might be available if you live in Henrico County and if you live in the city of Richmond or rural localities, just some areas have more resources than others. And a real lack of meaningful family and youth engagement. And that has been, folks, kind of felt like, okay, maybe we were invited to one meeting at the beginning, but we weren't really included in additional. So I just want to share a couple of quotes with you. And then if you want to move on to the next slide, I'll just read these to you. Some things that we heard. If you're an advocate for your kid, that makes it worse, because then it's like, who are you to know what I know, especially if you're not supposed to. If you're low income and you're brown, and especially if you're a single mom, you're not expected to have any kind of education, any understanding of what's going on. They want to be able to push you to the side, and as soon as you say, no, hold on, wait a minute, or you make that extra phone call or that email, now your child is a problem because the nerve of you to have said something in the first place. And so we'll move on to the next quote, because I just think these, and our report is full of these, but we just wanted to pull a couple that were especially poignant here. So it's like, you're here for me, but then you go talk to my guardian and she tells you that I've done something wrong. So then you're like, oh, she knows what she's talking about. You're a child, you don't. And then how can I build that relationship and trust that you even got the best interests at heart? And then also, I believe that race plays a big factor in that. So if you go on to the next slide, essentially, we also, in addition to kind of getting these challenges, we've had intentionally focused discussion around what are some potential solutions? Like, what kind of things works, or what kind of things do you think would work? And there were a number of them. And again, we kind of pulled out the ones that were specific to this presentation or more geared around this, and also kind of the big themes. So the first was developing and maintaining a centralized resource and referral or resource or tool. There were a lot of different ideas around this, but we, have developed a referral and response protocol, which Chidi will tell you about shortly. But there was a lot of conversation around a centralized place where people could access all of the resources, whether it be web-based, and the whole idea about resources and not knowing where they were, and then not knowing how to navigate to get to those resources. So being able to have some sort of centralized resource and referral tool. Making care coordination a part of standard services. So again, that follow-up, not only knowing what each other are doing, so that's part of this project, is that if people are speaking off the same page and they're all using, for example, this toolkit of resources that we've developed, and they're all going through this protocol of how they respond and refer cases, then they are coordinating that, and then that follow through piece, which is a big part of this project. Prioritizing youth and family engagement. So this has been something that we've embedded throughout the entire project. And again, Chidi will get into that. But I want to point out that I think that it's really important. One of the things that we heard over and over again is that youth, and in the second quote that I shared with you, a lot of the youth said, they talked to my mom, or they talked to my dad, or they talked to my aunt or my grandmother or whatever, but they never talked to me. And so a lot of times what we find, and it was really a learning moment for me early on in the project, or particularly in the listening tour, was that we had this term of family engagement, and we lump into that category youth and then parents and caregivers. And sometimes we have to make specific, distinct efforts to reach out separately to those groups, because we can't necessarily rely on one to speak for the whole family. And then implementing more holistic, proactive approaches to supporting children, youth, and families, and the providers who serve them. So again, these really family-centered approaches, and not just kind of piecemeal referrals to the places that we always send them. And we wanted to kind of talk here, I'm going to turn it over to Chidi to kind of try to get some feedback from you all on some of what I just shared about the listening tour.
Yeah, and Chloe just acknowledged that some of those quotes were quite powerful, and you can tell they are definitely in the voice of people who experience people and their experiences, one from a parent and one very clearly from a youth. And if you actually were to go back, Chloe, and just pop back to the first one, if we really were to dive into sort of the meaning that we're seeing and the experience here, very much so this parent is saying, listen, I was trying to advocate for my kid, but as soon as I did, the impact of being perhaps low income or brown, and I don't know who this individual was, but I'm assuming because they elevated that they are maybe one or both, or a single mom, that they were, sidelined in the conversation and the dialogue. And you can imagine that also means they are sidelined from the conversation about what is going to happen to their child, and the decisions that could very much have a very strong impact on the direction where that child goes, whether this is academic, social, emotional, or physical. And so the next quote very much outlines the experience of a young person who is sharing just that she or he or they were trying to say, this is what I want, these are my desires and wishes based on who I am and what I want for my life or future. And the adult in the room really clearly just said, well, it's not about what you want. And so what does that do for the trust in relationship between this adult who's supposed to be helping and guiding and the person and the young person who clearly is in the midst of some experience? And so if we were to move forward to our community chat, we wanted to open up the floor for a few minutes, just from your different experiences, whether personal or professional, your backgrounds, the roles that you play, whether you're an advocate, a service provider in some capacity, or just a community member. Do the anecdotes that we've shared in these quotes, or the themes that came out of the listening tour that Lori just shared, resonate with you or your work and or your community? And so we'll just open up the floor to that. If you don't feel comfortable actually unmuting yourself, feel free to share in the chat box. We see lots of folks sharing why they're participating this week in the various activities. But when it comes to this chat, we welcome folks to unmute themselves and actually just share their experiences and thoughts. And so we'll open up.
I'll share first. I have a thought that resonates with the second quote. Yeah, the second quote really resonated with me. When I was a child, I dealt with a lot of child abuse. And there was an incident where I actually ran away from home after my mother was trying to fight me. And I went to a friend's house and they called the police to report the abuse. And I also had my aunt on the phone who was familiar with the abuse as well. And the police officer promised that he would not make me go back home. But the second that he talked to my mother, his entire mood changed. She was very manipulative, and so he believed her more than me. And he pretty much took me back to her house in a police car and said, I was your age once, and I learned how to be quiet. And he said, I got a few whippings, and his affirmation was, I learned how to be quiet. And so I think a lot of times children are expected to be quiet and to be seen and to not be heard. But in that particular situation, I was dealing with a lot of abuse, and later I ended up being removed from my mother's home. But that experience has still resonated with me today, the expectation to be quiet. And I think that's why I'm so passionate about speaking up for children as an advocate.
Thank you, Chloe. That was so powerful, and absolutely, you know, if we were to even dive in deeper on what that meant for you as a young Black child, in particular, in a space, in any community, we would probably be able to go there too. Is there anyone else who would like to share either personally or professionally experiences that might relate or resonate for you?
Rachel Reynolds via chat. Rachel, would you prefer to, do you want to talk some about that off mute, or do you have to go off mute?
Yeah, I don't mind. I just think I love hearing the individual family quotes, but I think it definitely resonates in something that we see a lot in our resource center. In terms of a lot of times families come to us and you hear their stories, and that's one of the things that they say is that, you know, they feel like they've just been passed from provider to provider, or they don't know where to go. And I think the system, as siloed as it is, kind of creates that, you know, it perpetuates that, because you know, they get told, well, now go to the community services board for this, and now go to this provider to fill out this form, or, you know, no, you didn't do this correctly. And it's no wonder that they get frustrated. And I think it's definitely more of a challenge for people of color as well. You definitely hear their voices come through that they feel very ignored or passed off or dismissed. And they have very valid voices to share. So I just echo everything that has been said.
Thank you. Is there anyone else who would like to share? Well, if something comes to your heart that you would like to share, please feel free to put it in the chat box. We welcome activity even as we move on past this community chat. What I will say is that, you know, the original title of this community chat is, you know, child and family voice and choice in service delivery. And so when we think about experiences that people go through, especially young people, adverse childhood experiences as they may be, what does it mean then to come in contact with the system and then be let down by that? What does it mean then to come in contact with the system and to try and use your voice to advocate for yourself or for your loved one, whether that's a child or a neighbor or a friend, and that voice just completely, to use Chloe's words, be silenced? And so we just want to keep that on the forefront of your mind, not only for the impact of anyone, but for this conversation, particularly for people of color in our communities throughout the state and really throughout the country. So segueing into our Virginia Heals model of service delivery, if we could just go back one more slide. After the listening tour, which we heard stories like the ones we've heard today and more, we decided and felt very strongly that a model of service delivery needed to be consistent in communities for the exact reasons that individuals really feel like they're not being heard, they can't trust the system, it's not doing what it's intended to do, it's frustrating, it's exhausting, they're getting lost in the cracks between referrals. So how do we take our findings from the listening tour and develop something and implement it so that it works and so that it's effective? And so our model of service delivery, we can go on to the next slide, is inclusive of many resources that were developed that we hope will be able to be solutions to some of those barriers that we found. And so I'm just going to do a quick little run through of each of these resources without bombarding you with information. All of this is available at our website, virginiaheals.com, for free, and many of them I will go into have e-learning modules so people can take the online trainings which accompany those resources to be able to familiarize themselves with them further. So the first thing we created was the trauma, well, not first, but one of them was the trauma-informed agency self-assessment, which is really an assessment that is brief. It can be broken up into many parts, done individually or collectively by an agency or organization, to really be reflective about the policies and practices within the agency or organization itself, to see how truly trauma-informed it is, not only for those who are coming in contact with it as people in community, but also for the service providers and for the staff who work within it. We all know that there are organizations that can preach that they are trauma-informed. Everyone really is trauma aware in some capacity or has attended some training, but they're still asking for payment at the front desk in the middle of a waiting room. And so what does that mean? Maybe there are no locks on bathrooms. Maybe there are policies about leave that actually are not very trauma-informed at all. And so that assessment is available for people to do in strategic planning as they are reviewing how trauma-informed they actually are, or at any point or juncture if they wish. The Family Engagement Guide is a tool that was developed kind of off the cuff, actually. I believe it was supposed to be a one-pager or so and turned into this amazing resource, which really was all about engaging families. So if you are an organization and you're finding it very difficult, or you are not engaging families at all in the events that you're holding, the programs that you are having for individuals, whether they're young people or children or single parents or individuals who identify in the LGBTQ community, just anyone that you are trying to engage, non-English speakers, how do you really bring them into the fold so that they can be a part of whatever your system or organization is? We know how strong and how amazing it can be when people are engaged, how much more impactful the resources that are available for them become, and how the outcomes are improved if we see that positive family engagement. So this guide is a great resource to kind of review what we are doing to ensure that we are getting the voices of those who we work with involved. The community resource mapping facilitation guide, answering that call, which was, well, we don't really feel comfortable screening for trauma because what happens when we find out how many young people actually have experienced horrible things? We just don't have enough resources and child psychiatrists to be able to address their needs. Well, one, that's not an excuse for not asking the difficult questions. And two, your community might actually have more resources than you anticipated, and resource mapping could actually be a great way to identify primary and secondary and tertiary resources that we don't necessarily think that we know are not clinical, but can have really positive impacts for young people. And so the resource facilitation guide literally is a play-by-play, a playbook for someone or a small group of people to hold an event. It's got everything from the invitations to the agenda that you can fill in and all of the tools and resources that you need to have a successful event. Our referral and response protocol is really a protocol which goes really well with our C's, our screening for experiences and strengths, which is essentially after you've identified trauma or victimization. How do we ensure that we're not losing this person in the system? For a long time, we've said closing the loop, but really, how do we ensure that we refer them based on what their personal choices are for their most pressing needs, their identities and their expressions, and get them to a resource that is going to be able to help them the most. As service providers, a lot of times we think we know what someone needs, but it might not be what they actually feel is most important to address their biggest challenges in life at the time. And so this referral and response protocol is kind of our project's really big baby, because we feel that when it comes to service delivery, without a universal or uniform or consistent, at the very least, practice of referring and responding to people's needs, we will continue to see a lot of the same challenges that we see today. And lastly, our C's is our screening for experiences and strengths. It is a tool that was developed by our project over the course of the last few years. It's gone through 3 iterations and had 3 pilots. We had an IRB and had a report and data collected by Virginia Commonwealth University. And so it is an evidence-informed screening tool. And it can be used by anyone in community to be able to screen children and youth for trauma or victimization, so long as they've been trained on how to use the screening tool and also trained on how to screen in a trauma-informed way. And that's really important and critical to our project, that people are just not picking up a screening tool and asking difficult questions to young people about their experiences. And so each of the, with the exception of the trauma-informed agency self-assessment, we have not only the resources online, but also the trainings or e-modules about those resources online and available today. They've been online actually for a couple of weeks now, so we're really excited about this. We can move on to the next screen. Just moving into some of the highlighted points for each of those tools that we felt really related to the topic of family voice and choice, and the parts of them that we really felt answered that call, which was, how do we engage families? How do we ensure that young people are identified and that they are given the permission to make decisions about their life in situations like the ones they're in. So with our screening tool, we definitely were sure to say that when it comes to screening, we don't feel that, say, an organization who wants to start using any tool, our tool or any tool, should just be able to say, well, I really feel like Jackie should get screened because that young person seems like they've had some horrible things happen to them. Naturally, that leads to not only skewed data, but also the biases that we all naturally have in starting to target people based on what we think their needs are, but also what we think their experiences are. And so we're really feeling it's important to say that we feel if you as a service provider or a community or an organization feel that you want to start screening, that you do a universal screening of whatever the subset or population you want to understand better, that everyone is getting screened. So if you feel that you want to screen all 9 to 12-year-olds, please screen all of the 9 to 12-year-olds that come into your system. Do not pick and choose who you want to screen. There's dangers that come with, especially for people of color, when systems that they're involved with just start deciding, well, we're going to make gross, statements about all these things that have happened to LGBTQ youth or to people of color. We need to get proper snapshots. Obtaining permission, both from caregiver or guardian and the youth as well. So important, and something that came out of the listening tour. We were sure to include that. Explaining to a youth while they're getting screened that they can stop at any time. So important to empower them with that choice to say, I don't want to answer that question, or I don't feel like continuing this screening if they don't feel it's safe. With our referral and response protocol, making sure that we used an expanded definition of family was something that we really wanted to ensure we had. And so when we talk about, well, who do you live with, or who are your parents, Well, maybe I don't live with my parents. Maybe I live and have lived for a very long time with an aunt or a grandparent or a neighbor who has been my guardian since I was very young. Perhaps there is someone who I consider family who is actually a teacher or a counselor or a coach. And that is the person that I go to that is trusted. And so using that expanded definition of family was really important and critical, especially in today's world. Of course, when you're referring, there may be many things at play. There may be food insecurity, housing insecurity. There may be someone in someone's life who may be bullying them, but one of those may be an experience that really is a priority in that young person's life. So getting them help in that area that they have identified is really important, not the one that we as service provider feel is most important. And then of course, assessing for and acknowledging the background of an individual, whether it's their racial and ethnic identity, their language needs, their orientation or gender identity and expression. So important to take into account when we are working with people in community. One more screen and then I'll pass it off to Lori, I believe. Just want to continue to say that with family engagement, our model and different resources really just take into account that providing diverse interventions is so important to individualize those services that we are referring people to, especially based on the family's needs. And that is a program level strategy. When it comes to actual practice level strategies, we want to ensure that people are consistent and transparent with families about your role, whether as a mandated reporter or what the extent of your services is or can be, because we all know that sometimes we can't lean into a certain type of service. We have constraints and everything from timing to availability to cost, all of these things we have to be transparent about so that we don't find families in a bind. When it comes to system level strategies, we want to ensure that we are creating as great of an equitable experience, differentiating for families, what they look like, who they are, who they're made of, particularly when it comes to the organizations and systems that we work within. So with that, I know that was a lot of talking, and I don't know, Lori, if we had any questions come up. I didn't come up for air there. We wanted to open up.
I had a question because you mentioned it's important to recognize different cultural identities and intersectionality. A lot of people feel that a colorblind model is more appropriate to not recognize race at all. So can you kind of explain more why it's important to acknowledge the cultural identities or ethnic or racial identities?
When it comes to service delivery, is that what you mean?
Mm-hmm.
Yeah, so I mean, I think everyone here on the call probably has some understanding of why something like this would be so important. You know, race and identity plays so deeply into the experience that individuals have, not just in system involvement, but just in general in life, especially in this country. And so when we're talking about really sensitive choices, some that can have long-term impacts on a person's life, we need to be mindful of where they're coming from, the experiences that they've had, or the experience that maybe they've never had, but that their families or that their communities have had. So I think many of us know the impact of historical trauma. Particularly, I will highlight the impacts that have come in the form of health outcomes for people of color, particularly Black and Brown people. And a lot of times, it's not even something that one person has acknowledged or experienced personally, but rather just the knowns in their community that, oh, that doctor over there, they'll tell you that this is what's wrong with you. Or if you go to a dentist, they will indefinitely, you know, for sure they'll find something wrong with you. Or this is how they'll treat you, you can count on it. They can't help you. And so what does that do from an outcomes perspective for not just an individual or a nuclear family, but for a community at large? We not only would be remiss, but we do harm on individuals and communities when we don't acknowledge where they're coming from.
Yeah, and I would just add to that you know, a lot of what we did, particularly in the listening tour, but also even in just some of other, you know, research that's been done prior to us, but we really, and you'll see this kind of language about assessing for and acknowledging racial, ethnic, cultural, linguistic, sexual orientation, gender identity. We also have diverse and diverse ability. It actually is kind of a long list that's threaded throughout all of our toolkit resources, because what we found is that if you're really talking about doing something that is child, youth, family driven, then we really have to honor these specific identities of that child, youth, and family, which incorporates a lot of things. And so it's kind of the same reason why you just don't say, okay, everyone needs to get cultural competency training. Like, it's not the same. You need to kind of learn about the unique aspects of someone's identity, which involve all of those things, and not just bits and pieces, or try to generalize it for, it's not really youth and family driven if it's based on this group. It's basically the individual incorporates all these things, if that makes any sense. And that was one of the things that we really kept hearing, was that to be really specific and driven around children, youth, and families. And just wanted to get some discussion questions while we've got about 9 minutes left. So I think that's a good amount of time, but we would like to hear from you all again. So are there, do any of you have some specific strategies that you use to engage youth and families? And in thinking around that, do you, and some of what I mentioned earlier, do you have separate strategies for how you engage youth or those with lived experience, and how you engage the parents or caregivers? Are there separate opportunities or you know, that you could maybe share with the group, or maybe thoughts that you had around that? We'd love to hear from you. And admittedly, I will say this is something that as a team from the beginning, and I think that all service providers or program folks continue to struggle with this, and to learn about the best way to get that voice, because it's not necessarily like everybody, probably easier now, everybody could actually more easily come to a Zoom, but you know, when you're talking about coming to downtown Richmond to a meeting or wherever, that's a totally different thing. So does anyone have ideas or ways that you have done that in your organizations or agencies? Martin, I don't want to put you on the spot. Do you have any thoughts on that? Just because you've done some of that work, so.
So I know when I worked with a nonprofit in New York, a lot of our engagement in youth was trying to capture different programs or different opportunities within the city of New York that were giving opportunities or resources to youth. We were working with a truly at-risk population with juveniles that were recently released from Rikers Island. So you're working with 16 to 21-year-olds who really don't have an educational experience. They probably dropped out of high school. They don't have a work experience. And then they really don't have that adult figure around them that's guiding them in the areas that they need to be guided in to stay out of trouble or stay away from going back to Rikers Island. So it was a lot of teaming up with them as advocates to try to be that parent figure for them, but also using the resources that the city was giving us to connect them, and while connecting them, sticking with them to kind of walk them through the stages of whatever education or employment process that we were teaming them up with, because we found that if we team them up with a place for employment, that doesn't mean that they're going to stick with it. What helped them to succeed was being able to connect with them on a daily basis to encourage them, because sometimes if they had a bad day, for them, I'm going to quit. I don't want to do this anymore. So being able to pull them back, sit back and talk to them about that bad day and get them ready for the next day. But I think the partnerships that we were able to create within the city of New York truly helped to show what success looked like to the youth that we were working with in those instances. And then at the end of the day, it was using those youth to now be our voices when it comes to bringing in new youth who are going into similar situations. So kind of giving them more responsibility for than what they originally had. And again, that starts building the foundation for them to start growing in a way that we want them to be as a positive force in society for their communities. Hope that answered your question.
That was awesome. Thanks for sharing, Martin. Anyone else found in community, strategies that you've used to engage either youth or families separate from one another? Because we do advocate for that. They are two separate entities and should come together at some point, but also can have different perspectives. Chloe, I'll also have you pop to the next one because maybe this will also get folks to share out. Another question that we had were, do you think that the service providers in your agency or organization represent the children, youth, and families that you serve? Are there specific recruitment efforts at play to help get better representation?
I know, like, to bring it back to the nonprofit in New York, like when it came to fathers, they would create campaigns around Black fathers to make sure that they were able to recruit them and bring them in and not be under that stigma of Black men are not around for their children. So forming that group of Black men, even if some were absentee dads or some were, or there were others that were actually within the family dynamics, but bringing them together to form a group just with them. So now you do have kind of advocacy and a starting point to start bringing the family dynamic within whatever project or program you're working with.
Thank you. Muted, Laurie.
This I brought up, or we brought up, because it is something that, particularly as we were talking about our screening tool, and any kind of now, and I've worked in victim advocacy, but in a lot of different kind of systems, and just having and I can be fully honest, when I was in direct service and you go into a room, or you're training direct service providers and you go into a room and it's pretty much mainly a bunch of white women. That's pretty much like what kind of the advocacy work child welfare world is or has been for a while. And so I think that it's something that I, over the years, and I think that we all need to kind of engage in more conversation about how we specifically do outreach and recruitment to make sure that the folks that are providing the services more closely reflect and identify with the folks that they're serving. And I think that we, should all just kind of keep that in our minds as something that when we are looking at, particularly for folks that do frontline service workers, when we're looking at what our workforce looks like, just kind of a larger policy issue. I know that we are at our time, and I want to be respectful of that because we've been very good about staying on time. But just before we go, does anyone have any questions about anything that came up? Or if you don't, I would encourage you to please look at the website and know that we are available to, we do have these e-learning courses, but we are available to come to your, somehow virtually come to your organization or we'd like to do it on a regional basis, but whatever group that you might have, if there's one piece, we have a CAN training on the referral response protocol and the screening tool. But we have other trainings that we adjust. If you just want to get trained on the screening tool, or you just want to learn more about resource mapping or whatever it might be, that we will accommodate your needs. And, you know, if you want to look more into those things, we would love to share more with you now that we finally have our toolkit ready.
Yeah, and I'll just add in closing that we were really glad that we were invited to participate in this week. So Chloe and to Voices, thank you so much for all of your efforts this week. Thank you to everyone who joined us today and for the activity in the chat room. Thank you for everyone's commitment to reconciliation and to the work that we need to do, being honest with ourselves and with others about the challenges that people of color face every day, especially when they come in contact with those of us who work in systems, whether it's education or child welfare or the justice system. It's so important that we are mindful of all of these needs at all times. So with that, thank you so much for joining, and everyone have a wonderful day.
Thank you everyone for joining. You can visit our website for updates, and also we have yoga later on today at 7 if you need to rejuvenate yourself. I would recommend attending that. I'll be doing it.
I'll be there.
Thank you, Chloe. Thank you.